Charity-dependent. When an organization relies on charity/donations like hospitals in the Renaissance did after Henry VIII shut down the monasteries. Inheritances. When someone leaves their wealth to someone or an organization, some rich people did this to fund hospitals or paid a subscription in charity. Foundling Hospital. Thomas Coram spent 10 years gathering funds to open a hospital to care for abandoned children, as many were abandoned because of money or being born outside of marriage. Domestic and military service. Being trained to serve in someone's home or in the army, most of the children at the Foundling Hospital were trained for these roles. Cure and care. During the early modern era, many of the physicians, surgeons, and others worked in hospitals and provided treatments, unlike the medieval era. Nurses. Nurses in hospitals were untrained and usually unskilled, learning on the job. Carers. Women continue to play an important role, as most people continue to be cared for at home because physicians were expensive. Hospitals, early Renaissance. The patients had a good diet, had visits from physician and some medication. Hospitals, dissolution of monasteries. Henry VIII closed monasteries with the hospitals 1536-40. By 1700 only 5 remained. Apprenticeship. Training on the job by shadowing someone who does the job. More than 50% of the physicians on the medical directory in England had trained this way. Surgeon. Considered inferior to physicians because they had only apprenticeship training and were a cheaper alternative, basically a barber surgeon. William Cheselden. A surgeon known for speed and skill, was said to have removed a bladder stone in less than a minute. The best a patient could hope for was speed, as there was little pain relief other than opium and infection was widespread. Royal College of Surgeons was established in 1800 to collect together the works of specialist physicians, although other little groups existed before this. Medical degree. Having a university qualification to practice medicine. In 1856, only 4% of the 10,220 doctors in the medical directory had a medical degree. Worrying. The City of London. This refers to a central area of London. In 1811, to be a surgeon in this area you had to do a course on anatomy and on surgery at a university, not needed everywhere else. John Hunter. A famous teacher of anatomy who built a huge exhibit museum of human parts for surgeons to be able to study and to teach his students. The Two-Headed Boy of Bengal. A famous part of his collection, a 7-year-old boy who had an extra parasitic head. When he died, his body was shipped to Hunter by the East India Company. It drew lots of attention. Burking. Burking is killing people for the purpose of selling the bodies to surgeons for dissection. Hunter's critics accused him of taking advantage of this because he spent so much time dissecting. Father of scientific surgery. Hunter is known as this because of his methodical approach and dedication to teaching about his discoveries.